Okay, my name's Tiffany McAnally. I have done my patient on peripheral artery disease and the Raynaud's phenomenon. My patient PA is a 68-year-old African American female who presented to the emergency room after a fall at home. She had developed right leg pain, numbness, and tingling to the right lower extremity. She was found to have an ischemic foot and multiple ischemic digits to her hands and feet. She complained about having low blood pressures lately, but denies shortness of breath, edema, nausea, vomiting, fever, chills, or diarrhea. Upon examination, her ear, nose, and throat were unremarkable. Lungs were diminished. Heart was regular rate and rhythm. Abdomen soft, non-tender, bowel sounds present. Neurologic was she was lethargic but still able to follow commands intermittently. Her skin, her right foot was ischemic. First and second toes also had dry gangrene. Uh, First, second, and fourth digits to right hand had ischemic tips, and the left hand with third and fourth digit ischemic tips. Past medical history is end-stage renal with peritoneal dialysis, hypertension, diabetes, hyperlipidemia, renal cell carcinoma, um, Raynaud's disease, and peripheral vascular disease. Surgeries include hysterectomy, shoulder surgery, knee replacement, gastric bypass surgery, cholecystectomy, multiple finger procedures, panniculectomy, and she has a history of alcohol use occasionally, and she was a current smoker until recent hospitalizations caused her to be unable to smoke. Family history is unknown due to the current neurological status of the patient. Her current medications are Tylenol, Lipitor, calcitrol, Foslo, vitamin D, Lovenox, Pepcid, Lasix, Neurontin, Midodrine, nitroglycerin, Zofran, potassium chloride, Percocet, and Humalog sliding scale. My patient, while in the emergency room, had an x-ray of the right foot that showed generalized osteopenia and soft tissue loss, but no evidence of osteomyelitis. The first and second toes had dry gangrene. They did an arterial Doppler showing severe right lower extremity peripheral artery disease, and no flow was detected to the distal or popliteal arteries. Vascular surgery was consulted, but after review of the test and evaluation of the limb, they decided the foot was non-viable and recommended a BKA, which was done on 122. It was also recommended that the patient have amputation of the right and left hands with the ischemic digits present. Peripheral artery disease is a progressive narrowing and degeneration of the peripheral artery. Plaque builds up into the arteries that carry blood to your head, organs, and limbs. This condition is called atherosclerosis. Over time, the plaque hardens and narrows the arteries and limits the flow of oxygen to the body. Peripheral artery disease can cause pain and numbness in the affected area. If severe enough, can cause gangrene and lead to amputation. Risk factors include smoking, age, certain races, for instance, African Americans are at higher risk, and other diseases such as hypertension, high cholesterol, ischemic heart disease, and stroke. Intermittent claudication is a common manifestation of the disease. It consists of pain, numbness, aching, or heaviness in the legs, in which my patient did experience those manifestations. Also, the patient may have cramping in the affected leg and buttocks, thigh, calf, and the feet. Symptoms may ease off with rest. During activity, your muscles need increased blood flow, but if the vessels are narrowed and blocked, your muscles won't get enough blood, which can lead to those symptoms. Other signs and symptoms include weakness, weak pulses, sores that heal slowly or not at all, pale or bluish color of the skin, and erectile dysfunction. It is usually diagnosed with Doppler sound, a treadmill test, magnetic resonance angiogram, or an arteriogram. Treatment is bypass grafting, angioplasty with stent placement, atherectomy. Patients may have to take medications such as statins to decrease their cholesterol levels and reduce the possibility of plaque buildup. Lifestyle changes is also treatment. Exercise and changing your diet to a healthier diet to reduce your cholesterol levels also can decrease the possibility of developing PAD. My patient was diagnosed through the arterial Doppler results, as well as she wound up having a CT of the abdomen and pelvis showing that the arterial tree in the right lower extremity had significant occlusion. So the patient had a complete amputation, and that was her treatment for that. The reason this patient was more interesting to me was not only because of the peripheral artery disease, but she has a history of Raynaud's disease. Raynaud's disease is a vasospasm of the arteries, reducing blood flow to the fingers and toes, sometimes the nose and ears as well. And only about 5% of the population have Raynaud's disease. And risk factors include being a female, age 15 to 40, autoimmune disorders, and living in cold climates. Some of the manifestations of Raynaud's is arteries restrict where there's no blood flow, fingers turn white and then blue the longer the blood flow is restricted. And then after the fingers start to warm up and the blood flow returns, the fingers turn bright red, throb, tingle, burn, and feel numb. These attacks can last minutes or hours, and the longer the episode, it increases the possibility of tissue damage, resulting in sores and maybe even gangrene, in which my patient had. So it kind of comes up to question was it the PAD or the Raynaud's that started her issues with her feet? Diagnosis of Raynaud's is usually just knowing the signs and symptoms and seeing the changes in your hands or toes, or whenever you have cold stimulation. A cold stimulation test can actually be performed where they just put your hands in a cold area and watch the process occur, or Nephril capillary test can be done to check your blood flow there. And then blood tests can also be done for other disorders, because most time Raynaud's is connected to other diseases. For instance, hers is the peripheral artery disease. Treatment for the Raynaud's is only to keep your hands warm, keep your body warm, your hands warm, wear gloves when you take food out of the freezer or refrigerator to prevent the stress from occurring to your hands. Also avoiding stressful situations, caffeine. You can be put on medications to cause vasodilation so that your blood is flowing to your hands and toes better in the winter months, like calcium channel blockers help to increase the blood flow. This patient didn't initially present with this disease to the ER. It was her leg pain, but she was found to have ischemic fingers and toes due to this disease process. So this patient was in the later clinical manifestations of Raynaud's, and the patient's supposed to have her digits amputated when she gets better from the leg amputation. So with this being said, whenever I found out about this patient, I was told that this patient was going to get her her leg cut off because she had Raynaud so bad. And it kind of scared me because I recently have been diagnosed with Raynaud. And so I've been researching and finding out what you have to do, and mostly it's just lifestyle changes. But with this patient, I wanted to see what kind of health history she had, if she was smoking, which increases Raynaud's, and just if she had changed any of her lifestyle and what other diseases that she had that could be connected to it. So that's why this patient was so interesting, and I know that it's just different. So the only 5% people having it, anybody that has Raynaud's will be interesting to me. I obtained the information about peripheral artery disease and Raynaud's disease both from the National Heart and Lung and Blood Institute website. So that's all. Thank you.